among the many specialties within the field of medicine and surgery, the endoscopy is something that is somewhat immediately gratifying in that if you perform these procedures, not only you can actually provide a diagnosis that may lead to potentially treatment or even cure, but perhaps you as the interventional endoscopist alter the course of the patient's outcome for the better. Most of the patients that come to my care have some concerns, some level of concerns for GI malignancy, whether it is esophageal cancers or pancreatic cancers. They have a certain amount of built-in anxiety for their disease state, which makes my job and my responsibility in a bit more rich in that not only I should be providing the correct diagnosis and perhaps appropriate interventions, but also hopefully can provide some sense of a comfort in that even the diagnosis, even if it may be something of a ominous diagnosis, if we can diagnose and detect early and actually refer these patients to the experts within the Cleveland Clinic, the outcome may be much more favorable. I think being in Ohio actually taught me how to be a gardener. So the small garden that I have is a tranquil time of mine where I can actually put aside of all those things. And I think there's something therapeutic about touching the soils and actually see the outcomes of what you have invested coming out in a certain time. So that's what I do these days.